everybody, this is Dr. Joe Borio with this week's Change Your Health, Change Your Life. I got a great research study to share with you, and it's about asthma. I'll tell you, childhood asthma has been on the rise significantly over the last 20 years, and there's a lot of different reasons for that. A lot of the research is showing that the advent and use and utilization of antibiotics have caused a dramatic increase in asthma. In fact, some of the research is showing now that if you utilize an antibiotic in the early childhood infant period, typically within the first year, you increase the likelihood of a child developing asthma by 9 times. 8.9 times was the actual statistic. So 8.9 times, and the scary stat is that 90% of children within their first year of life in the United States have had their first round of antibiotics. And then what's even scarier is that 80% of the people that die from asthma are not dying from asthma, they're dying from the drug treatment for their asthma. So unfortunately, with the greatest intent, we're causing asthma, and then we're causing ourselves to get sicker and die from asthma from treating it. And this isn't an anti-drug, anti-medicine. This is really a pro-health approach. So what we have to look at is, why are our children getting sick? Why are children developing these problems? And what we know neurologically is that the nervous system houses the potential, the full potential of your body to heal. It's critical for the nervous system to be able to talk and communicate to the body. Why? Well, first off, if the nervous system can communicate and talk to the body, I'm less likely to get sick. So often when we're treating these infections in childhood with antibiotics, many times the child wouldn't get sick in the first place if we could get their body to work better and focus on keeping their immune system to be strong. One of the ways we do that is to keep the spinal alignment healthy. And a great study, this was done in 1995, and it was done on pediatrics with children, and it found that a reduction in asthma was seen with a group of children directly correlated with the health of their spine. So meaning the straighter and the healthier their spine is, the less likely they were to suffer from asthma or asthma symptomatology. Often that's going to be measured by vital lung capacity, their ability to breathe. Spirometer is another tool they use to measure. According to the study, all children had measurable improvements on their x-ray. So films were taken of the child to measure where their spine was out of alignment, where their spine was crooked. And then that they correlated the improvement of the x-ray alignment, or the alignment seen on an x-ray, with their asthma. So the straighter and the healthier their spine got, that meant that their nervous system was working better. Therefore, it was a direct correlation showing that they had a dramatic increase in their asthma symptomatology, meaning they didn't have as much asthma or any asthma. Some people like to use that word cure. I'm uncomfortable with that word, okay? But the parents of the children involved in the study reported there was a significant reduction in the need for medication to control the asthma symptoms. 7 parents stated that a child reduced their symptomatology so much that they were totally off all the medication. So knowing that the medication, as well intended as it may be by the child, the nebulizers, the inhalers, the pills, and so forth, as well as intended as it may be, it's not the cause of the asthma. A child's not having asthma because they're deficient in those drugs. The child has asthma because something else is wrong in the body. So we want to look at that. So from a neurologic standpoint, a chiropractor is concerned in addressing where the spine is out of alignment. Now, the technical term for that is subluxation. And that word is very specific and unique to chiropractic, much like a gingivitis would be to a dentist, or arteriosclerosis would be to a cardiologist. So that word is very specific. So what chiropractors will do is they will evaluate and assess the health of a child's spine to make sure that all the messages can get from the brain to the body. Because if you remember, your brain is sending data, communication, information down the spine to the body, and information is going back up. So the healthier the spine is, the better alignment is, the more messages get there, and the healthier the body will always work. The healthier your child is. So much like dentistry, where we're brushing our teeth not because they hurt, but so they don't hurt, so they don't get sick, the chiropractor's role, the chiropractor's job, is to get involved in the alignment and health of the spine so the spine doesn't get sick. So all those messages can get there and the body can function just like it's supposed to. And a beautiful side effect, a great benefit, is that a child with asthma will greatly improve. The majority of children will greatly improve with their asthma, some being so-called cured or totally abated, others maybe a reduction in the medication, but you'll see a significant improvement in your children who have asthma if their spine is in better alignment, if their spine's healthier and the messages can get there. Hopefully this helps out for you guys. If you're local in our area, we'd love to have you part of our practice. If not, certainly call a chiropractor that's in your area that works with children, or call me and I'll make sure I find somebody good for you and your family, because your whole family should be under care. And remember, guys, the keys to staying healthy, right? What do we got to do? We got to eat well, we got to exercise, we got to drink good water, get a good night's sleep. We got to think those positive messages, those positive thoughts. And remember, you and your mother and your grandfather and your cousin and your uncle and your co-workers and everybody you know and everybody on the planet should be under regular care to keep those messages from the brain to body and keep you healthy, not only short term, but for the rest of your life, guys. Listen, have a great week. Have fun with your family. Enjoy. I'll talk to you guys next week.